Civilization is a story. Health is a story. Wisdom is a story. Love is a story. A pill is a story. Your life is a story. One of the interesting things about these stories is that there's always more to the story. And we live in a time where we have new media, which enables us to talk about different stories in different ways. And I have an interest in figuring out how far we can push these media. So the question is your life one big tweet? Because your life transpires through the media of time and space. But there are all sorts of other stories. So how big is a tweet? Well, according to some calculations, you've got 26 letters in the alphabet and 140 characters combined. So that's like 1 times a lot of zeros. So clearly we can do things in these little pinging ways. And for me, Twitter is a metaphor only for the direction of our communications in this century. So we're talking about an iceberg principle. When you listen to a patient, they may emit something that's the size of a tweet, but beneath that might be a story of alcoholism or child abuse or cancer. There's always something more to the story. This guy was the greatest tweeter ever. He understood the iceberg principle. He understood there's more to the story. And of course he was ahead of his time, because there he is with his LOL cats, and he's got his tweet deck up there pounding out the tweets, the tips of the iceberg. Okay, and this is what you all need to work on. Shortest story ever written, he came up with it. For sale, baby shoes, never worn. It's adorable, but there's more to the story. Worst thing that can happen to a parent is to lose a child before she's even born or can't even wear its shoes. There's always more to the story. Now, I've always been interested in how far we could push these new media. Can I get clinicians, can I use something like Twitter as a gateway drug to get them to share their stories? So about 2 years ago, this month, I had started RN Chat. And that was a medium where nurses, let's skip to MD Chat. I created RN Chat, and then a year later I created MD Chat, where doctors and nurses could trade their stories and express themselves in a public medium that was never really done before. And after that, once those communities were layered in, I was able to then launch and layer in the patient perspective. So once we had the docs and the nurses comfortable listening to each other in this medium, we then could get the patients involved. And so my hope was to bend the medium to see if we could get patients to tell their stories and use these media as a way to tease out those little pearls of wisdom outside the traditional context which providers get used to, and they kind of get into this siloed box. And I was hoping we could do that. So I put out a call, and I got a pretty quick response from organization. Albert Einstein College of Medicine came back to me, long story short, and said, we can cooperate with Alzheimer's Association and get a couple patients to tell their stories who are comfortable doing this. And we were able to get not just one, but 2. Both these women had younger onset Alzheimer's. But Gwen Richards, it took her over a year to get a diagnosis, in spite of the fact that her mother and other relatives had the illness. Somebody wasn't listening to her story. Libby Embry, on the other hand, well, Libby took about 2 months to get her diagnosis going. So clearly these were similar conditions with different stories. And so the idea of taking on the crazy task of having a tweet chat in an hour where these 2 women could simultaneously tell their stories could extract those pearls of wisdom. So here's a couple. Quite soon, I will not even realize that I have Alzheimer's. This is a vicious disease. And when you pull and tease this out, it makes it more evident, more palpable outside the clinical context. Getting lost, I could not remember what the red light meant. This is a disease that strips parts of your consciousness from you. And I hope all of you appreciate that you can recognize and remember what the red light means. Again, pearls of wisdom. Flipping, attention deficit, real quickly, this is your homework assignment, okay? Don't take the psychotherapy live tweeting literally. Think about it as the ultimate test for how we can use these media to help storytelling in healthcare, because there's clearly dangers in these media and using this site. So again, it's like the tip of the iceberg. Explore it. There's more to the story. It'll be revealed. Now we're here, we talk about empowerment, but there's two things that often get overlooked in empowerment. It's ultimately about storytelling, but it's not enough to be empowered. People have to feel it. So if you don't feel empowered, you won't use it. So for being empowered, you have to tell informational stories. For feeling empowered, that's where the inspirational stories come into play. So what I hope I'm conveying is that the story is both the foundation and the capstone of civilization. The story transforms the iceberg into this place, a place where we can have conversations, where we can have a life and have wholeness and have wisdom. So, because we need places where people can share their wisdom, their pearls of wisdom, string them along in retweetable ways to make care more attentive. I want you all to stand up and give these ladies a big applause. Stand up like Seth Godin, stand up even higher than you wanted to. Give them a resounding applause. These are the Hemingway heroes of the 21st century.